Du Bois Regional Medical Center under Penn Highlands has entered into an agreement with LECOM, and they're now starting to have medical interns at the hospital and doing the program. They're in the second phase of that. And my concern is when you have this kind of a situation going on, it was a lot of struggle and a lot of work for Dr. Lisa Witherite-Rigg and the others that were involved with this to get this program up and running. What's the likelihood, given St. Luke's experience, that we could see something like that just go away?
Are you talking about the programs going
away?
The
programs, yes.
Well, it would be a determination made by each individual hospital or health network based upon the concerns as to being pulled into these high-risk venues. Having discussions within our own institution, we've looked at what we may need to do to divest ourselves of these alleged relationships, quote, doing business in Philadelphia, to protect the healthcare institution on its own. I can't answer the question as to what would happen, but in most instances, the plaintiff's lawyers will attempt to find any connection to a higher risk venue under the proposed reversion to the rule of, quote unquote, doing business in that county. So the question of what doing business in Philadelphia or Allegheny County or any other county is really one that's determined by any judge. And there's case law on that, but again, much of that, as it relates to hospitals, goes back to prior 2002.
Thank you. I've done defense work as an insurance investigator in the Philadelphia area, Baltimore, Washington, D.C., and Delaware. And it's interesting, everybody wanted Philadelphia back in the early 90s. And looking at the difference, just defense attorneys such as yourself, you're coming in regular suits versus the $3,000 bespoke suits that we see from these attorneys that are making a lot of money off of having these cases heard in those venues. I appreciate your testimony, and I agree with you. I don't recall any in the 4 years that I was working where they tried to move a case out of Philadelphia to another location. Denai, you touched on something I want to follow up on. One of the things that I recall from a physician that I had, my general practitioner, who had left for Ohio back in the mid or late 90s, and talking with him about the reasons for his leaving and other older physicians that were making the same kind of recommendations you said about don't practice in Pennsylvania to these young people. It also affected those who were trying to sell their practices. Typically, you bring in a young doctor, they're there, the patients get comfortable with them, and it's a nice transition period. Could you cover a little bit about that? I know you went through it, or were around when it was there.
Right. Yeah, I was born, raised in Pennsylvania, trained in Pennsylvania, and came back and started working here in '92. And in the late '90s, this issue had been present and percolating, but in the late '90s, it kind of exploded. And yes, physicians weren't able to sell. They weren't able to attract young partners. And I think there was a sense among the profession that it wasn't fair not to be honest with people you were trying to bring in. So doctors, one surgeon I know basically didn't even try to sell his practice. He just closed and left. For the same reasons. He didn't want to lie to somebody coming in, and he didn't want to continue practicing here. So it would be problematic if this should come back. I mean, I think of it, when they say, well, the situation is better, I think it's like me saying to a patient, you had high blood pressure, you were at risk of a heart attack or a stroke, I gave you a medication, I treated it, your pressure is down, so I'm going to remove the medication. I mean, I don't understand the logic in that. What they're saying is, we've stabilized a situation, let's destabilize it again. I'm not, it just doesn't make sense from a logical point of view. There's other ways it makes sense, but not logic.
Thank you. And Dr. Ades, if you wouldn't mind addressing that as well, because your heartfelt comments on that interpersonal relationship between the doctors and the patients, I think that, like I said, that transition period isn't going to be there. I'd like you to follow up with your previous testimony on that and how you think that'll relate.
Thank you for the question. Two instances come to mind. One is I had a conversation with my colleagues last night about this. And one of my colleagues is a nephrologist, which is not one of the big three. He's not an obstetrician, he's not a neurosurgeon, he's not an orthopedist. And even he was affected greatly by this. A lot of difficulty with recruiting young talent. If you don't grow, you die. And it's just like the healthcare industry is just like any other industry. It's important for us to recruit good talent. So it really did even affect him. So prior to 2002, this was a very far-reaching problem. The second is one of my best friends is an obstetrician. Probably one of the best clinicians I know, and a wonderful human being. The rug was really pulled out from him in his practice in 2000, 2001, where his carrier dropped them. And there was a great discussion whether or not they should close the doors. And this was a big OB practice, maybe 16, 18 providers, a big OB practice. You can imagine how that would affect the community with your doors just closing. Patient access. At the end of the day, it's all about our patients, our duty. And can you imagine that? But instead, they went for the Joint Underwriting Association, which was akin to giving your firstborn to pay for the first month. But it was a great hardship for him. And he's one of the best clinicians I know, and he's not reckless. He has a wonderful, in fact, I have trouble, my wife and I go out with double dates with his wife, and we have trouble going to restaurants because everyone is pulling him aside saying, oh, Dr. X, it's great to see you again. So, yeah, it really did affect us greatly. And we're very thankful that that had been remedied, and that's why we're so fearful that it'll be taken away. Yeah.
I was going to say, if you get a chance, read that poster on the way out. It references what he's referring to. That was a group of OBGYNs, I think, here in Harrisburg, 87,000 patients, and they came within weeks of closing their practice because they could not get liability insurance because the carriers had pulled out.